Now, is there more room for other providers to be part of the task force? Is it open?
Yes, any provider that is willing to come. It's an open invitation. We've built a group contact email that we communicate with them in real time and exchange information, and anyone is welcome to pass it around. It's open to all care providers. We ask that they send somebody that's clinical to the task force. Now, we have some people that are marketing in nature, business development that sits through the task force, but the most value comes from the clinical people being in the room.
Wonderful. We'll be sure to get that information out too as well. The next question I have was about the Senior Care Network. If you could talk a little bit about the Senior Care Network.
The Senior Care Network came later. We were probably about 12 months into our project when the feedback and the ideas started coming to us that there was this need that existed in the community. Ron and I made, from the feedback we were getting at our meetings, we started to make some site visits. Because keeping with our mission of what this task force was about, we wanted to meet the needs of the community, and we were hearing that there were huge gaps in getting the patients follow-up care, and without proper follow-up, you can't say that you have good continuity of care that can achieve the outcomes we're setting out to achieve.
Absolutely.
So we started making site visits, and with all the assisted livings and even some of the nursing home providers in the area, and over and over again, we were hearing the same thing. We can't get, there are physicians out there who will not accept Medicare members, and those that do, there's a long waiting list for patients to get in. So when the patients are in need to get in within a couple of days, nobody will accept them. So this is a struggle. We're having to make upwards of 10 phone calls before we can get an appointment to bring a patient in quickly. So, we took it back to the hospital and we tossed it around a little bit, explored several different options, and then the best option that we thought would work for the community was to bring our physician that are affiliated with us to our table and get some feedback from them and see if this is something that they would be willing to partner with us and do for the community. And the response was overwhelming from the group. They were very, very, they loved the idea. I'm proud to say that the physicians who partner with us love the idea of raising the bar on quality and care delivery for the seniors. They recognize that this was a need and it's something that they needed to do. So to date, we have over 55 physicians.
Oh, that's awesome.
That are a part of the network, and we have every specialty covered.
That's great. Wonderful. And then my favorite, and we're here today in the unit, the AC unit. If you could just tell us a little bit about the AC unit.
And again, the AC unit came about later, probably along the same time that the physician network was coming about. And again, the ACE unit was put together to foster continuity of care and optimize quality outcomes. The senior patients, as I said, the hospital is this is our community. We have a lot of senior residents here. We're nestled around all these senior living communities. So we tossed around some ideas and came up with, why not do this program where care delivery is truly patient-centered, patient and family-centered. So it's the ACE adult, acute care for the elderly, it's a concept in care delivery that it truly puts the patient at the center of delivery. We focus heavily on keeping the patients as independent as they were at their previous living community once they get into the hospital. It's a very, very common thing. Any patient, not just seniors, when you're in the hospital, it's there are those complications that are associated with hospitalization. If you're not getting out of bed every day, if you're not moving around as you're used in your community, you tend to develop a gamut of conditions like blood clots, or you become deconditioned, things like that. So our focus was to, once we get these senior patients in, let's keep them moving. We focus heavily in getting the patients up at least 3 times a day, have them ambulating in the hall, bring them to a day room so that they can have their meals in here, have some socializations while they're here. We have a multidisciplinary team approach. Every patient that is admitted to the ACE unit is teamed every day. The entire multidisciplinary team gets together the morning after admission, and they collaboratively set the treatment plan in place that the patient needs. 100% of the patients admitted to the unit gets a physical therapy evaluation. So the therapist can tell us exactly what kind of assistance they need, how should we be getting them out of bed? Do they need the assistance of a walker, a wheelchair, a cane, that kind of thing? And we post a sign over their bed so every caregiver walking into the room, or even the family members, can see that upon entering.
And just for the record, what normally happens when an elderly person is admitted into just a regular unit in a regular hospital and not an ACEs unit?
Typically, and I'll use our own hospital as an example, once patients are in a hospital and patients are acutely ill, especially senior patients, when a patient needs an admission to the hospital, they're going through some sort of crisis. They're ill. It's very easy to listen to somebody said, you know, I don't feel so good, so I don't want to get out of bed today. Just let me lay here, you know. And that's not the best thing for a patient. That's not necessarily the best thing for them. So we put a lot of effort into encouraging the patients to get up. In fact, we rarely take no for an answer. You know, it's in their best interest to get them up. So by kind of putting the focus on patient-centered care, we've done this campaign where we've re-educated all of our nurses, had to come to specialized training of how to manage the patients, how to handle them, what this all means. So even the care providers have a higher level understanding of what needs to occur when a patient is in the hospital, because it is very easy to get lost in the shuffle. The nurses get busy, they're passing out their meds, and they're doing those routine daily tasks that they have to go through. So we need to say, stop, you know, we want you to think of the patients differently. We want you to make the delivery of care truly patient-centered, do what's best for the patient. And I think it's worked to our advantage. It's the patients will have a much better outcome if we do it this way.
Absolutely. As I said, that was one of my favorite prongs of the three-prong approach that you all have, is the ACE unit. I want to just recap briefly the three-prong approach again, and that's the Care Transitions Task Force. And if there are any providers that would like the opportunity to serve on the task force, we'll have that contact information available to you at the end of the interview. Also for the Senior Care Network, and then again the ACE unit is another approach that they have. And I just want to say that I'm just thrilled to know that North Fulton Hospital is doing something like this, and I hope as trailblazers that you'll begin to see the advantage of doing this. As we talked earlier, offset about how it's important to be proactive as opposed to reactive. We all know that the population is aging and that the need is there, and so now's the time to definitely move forward and put processes and procedures in place. So I'm very excited about the opportunity, and I hope it's catchy, and I hope other hospitals will do the same thing as well. Thank you so much, Ron, for your time today.
This was great.
Yes,
Appreciate
and thank you, Kamela, for being the trailblazer and getting this project up and moving.
It's very nice to meet you.
Thank you.
Tremendous.